Board. There we go. So, Assalamu alaikum, welcome to webinar series. We thought the easiest way was to have Adam do a baseline kind of series throughout this process, just so to make sure everyone gets what we think is the minimum level of knowledge they need in order to perform Hajj. That way, anything you get from your guides and scholars, in our opinion, is supplemental and extra and can only be an addition to the knowledge you need for Hajj. But at least if you attend nothing else, and if you're unable to attend any of the seminars, but you attend this series, you will be good to go, ready for Hajj, inshallah. So with that said, the schedule today, inshallah, we're going to do first some housekeeping. Then we will get into what the main dish, I guess, of today's series is, which is kind of a focus on your health and your packing list and what you should be bringing, so on and so forth. So after we do the quick updates for the Rami, we'll get into the packing list with you and go through that. And then we have a guest lecturer after who will speak for a little bit. And then, as always, we'll end with the Q&A for any questions you may have. Now, onto your kind of where you should be at checklist. By now, everyone should be on the WhatsApp groups for their particular program, whether Al-Burj 11, 12, 8, 9, 10, Jameel, or Ithra. You should all be on your WhatsApp groups. You should all be in touch with your guides and scholars who are on those WhatsApp groups. And I believe all of them at this point have either had a seminar or have scheduled a seminar for the near future. So that should be moving very quickly now. So you should begin to kind of be involved there and getting your information from there. With this week, inshallah, I believe all of them have already messaged their seminars or have reached out at least on the groups. If you're not on the WhatsApp group or don't know what the WhatsApp group is, reach out to your Adam account rep to ask him to send you the link, inshallah, and get you on there. That's number one. Number two, as posted in the WhatsApp, most of the tickets have been issued. I say we're around 80%. This week is when we start trying to pass them out. We will try to get them to you directly, especially if we issued them. Otherwise, for sure, they will all be unofficially when we send them to Al-Burg or to Jameel or Thra. If you log in, you can find it on your NOSC account, and we outline it in the WhatsApp message as well. You should all have your Hajj visas by now, or at a minimum. If you haven't received it, let us know. They should be coming soon, inshallah. But I believe by now most have gotten their Hajj visas. Rooming is done, and we're going to deliver that to Al Burj and probably have your guides share that with you once after the first couple seminars. So probably next week, look for that, inshallah. Beyond that, I believe any extra requests, special requests, so on and so forth, to be with your account reps, passed over to your guides, and at least they should have known whether it's doable or not doable, or at least they should be aware of it. And that's kind of beyond the packing list. That's kind of what you need to get ready for Hajj, inshallah. We're going to start finalizing if you need domestics, they should be done. If you're arriving early, we should have discussed with the account rep what the solution is. We're going to sit with Al Burj and talk about those who arrive early to see what the process is for there. If you purchase a package with Jameel or Ithra that isn't guided by an Adam rep, Amr Bez should have been in touch with you to kind of find your guide and get you on that group. Otherwise, you are with Brother Hassan Masoud or the Taysir team, inshallah, for Jameel. And that's kind of just a quick rundown. Again, as always, Q&A after, and you're more than welcome to reach out to your account rep or even your guide at this point to start asking questions. Discuss. So, alhamdulillah, lots of people with information, lots of subject matter experts to guide you through this, inshallah. Our plan is to never leave you alone on this. You'll always have someone from the Al Burj Adam team available to help you, inshallah. And that's what's most important. So we get through this together. Sister Taniman, if you want to share the PDF, I can hand over the mic to Brother Rami, and he can begin going through the packing list, inshallah. Brother Rami, the floor is yours.
Jazakallah khair, Muhammad. Assalamu alaikum, everyone. Thank you for joining us on this meeting today. As Muhammad said, we this is inshallah just to prepare you, and today we'll be talking about the items that you must have, the items that you can purchase now, inshallah, before the travel, and the items that would be optional. You can get it here, you can get it in Saudi, inshallah, all of these information. So it's going to be short. We're not going to take too much of your time. We already spoke about these items in our webinars briefly in the 2 weeks ago, the logistical webinar that we had. So inshallah, we will go into a little bit more details today, so you can be prepared for with these items, inshallah. So the travel essentials. These documents and these items is a must to have uh, before the travel. So when you get to the airport, you need to make sure that you have this document, especially the first few, which is the passport. Of course, you cannot travel without your passport. The second thing would be your Hajj visa. So the Hajj visa, I believe, if not everyone, most of you or 99% of you got already their Hajj visa. If you have not gotten your Hajj visa yet, please make sure you reach out to one of your reps, me, my brother Amr, brother Khalid, sister Nariman, any one of us. Inshallah, we can follow up on this. But I believe everyone should have their visa by now. The When you get to the airport, they will ask you about your Hajj visa. You have to show it. It's best to have a hard copy. You show it as a hard copy. Keep it with your passport. You can show it in your phone as well. That's an option. It's an e-visa, so you can show it on the phone. If you are if you hold a green card or you are on a work visa, make sure you have, especially the green card, make sure you have it with you when you travel from the US. When you travel from here, they will not ask about it, but when you are coming back, it's a must to have. So that's something you must have with you, inshallah. The second thing would be the meningitis vaccine proof. As we mentioned before, the meningitis is a must to have for all pilgrims. It's one of the requirements, and so inshallah, make sure you have it. If you cannot take it for any medical reason, you can request a letter from your doctor that you have exemption. So inshallah, you can have no issues at the airport. For pilgrims who are 65 years or older, also for any pregnant sisters or any person with any any kind of medical conditions. They also require to have the COVID vaccine proof. So if you have it from the very beginning, the first and second shots, if you have that proof, that should be sufficient. If you took one recently, last year in 2024 or 2025, then this should be sufficient as well. So these are the vaccine proof that you need to have when you are traveling, inshallah. Money or debit card or credit card. So you can take cash with you. We don't recommend to have a lot of cash. You can have, US dollars. Make sure you have 100 bills. And inshallah, when you get to Saudi, there is many exchange places. Expect them to be crowded at some point, at some times, especially after the prayers. So you need but they're available everywhere. So inshallah, in Medina and Mecca, even at the airport, that's doable. But we recommend to avoid that at the airport. Just make sure you get to your hotel, and next to your hotel, next to the haram, many places you can do the exchange. The other option, which is you can use at almost everywhere in Saudi, is the debit card, credit card, Apple Pay. So all of this is available, inshallah. You can use it. What you need to do, you just need to make sure you contact your credit card company, let them know that you'll be traveling, you'll be using the credit card overseas. This way, they will not block it, and you can use it, inshallah. Photocopies of your passport and visa. This is very important. It's also very it's a must to have as well. So make sure you have at least 4 to 5 copies of your visas, so hard copies of your visas and passports, right? One copy always has to be with you at all times. Okay, whenever you go, anytime you leave your hotel, make sure you have a copy of the visa and the passport. Now, your passport, the passport does not leave your hotel. You get to your hotel, there is a safe. You can put it in the safe if you want. You can keep it in your luggage. It's very safe. Alhamdulillah, we never had any issues, anything missing from the hotels, from the rooms. So it's a very safe place. make sure you have your passport in your room. The passport does not leave. If the passport is lost, that's a no one wanna go through this issue, inshallah. So just keep a hard copy of your passport and hard copy of your visa, and keep them with you all the time, and you should be all set, inshallah. If needed, inshallah, you won't need them, but just in case if needed, you can you have these proof. The airline tickets. So many of you have received their tickets. Some tickets are being issued. Some tickets will be issued by early next week, especially Turkish Airlines. So I believe Emirates Airline issued, Qatar Airways issued, the Egypt Air, Saudi Airline. I believe most of them are issued as well. So we shared the way how to retrieve your ticket from your Nusuk. So you go to log into your Nusuk account, you go to my profile, and you click on the drop down list to my itinerary, and then you can see the ticket information. Now, some kind of tickets or some accounts, I believe you can download it, and some other kind of tickets there's no option to download. They just provide you with a PNR number and the ticket number. In that case, if you don't want to wait until you receive the hard copy, or sorry, until you receive the email from Adam Travel with your ticket, which will happen in this coming week, inshallah. So expect to start receiving your tickets by email from Adam Travel early next week. I would say Tuesday, Wednesday at the latest, inshallah, you should have it. We will update you on the WhatsApp chat as well. If you don't want to wait, you can get to my itinerary, get the information, go to the airline website, enter the PNR number or the booking reservation number and your last name and the ticket number, and you should be all set, inshallah. You can retrieve it. You can some airlines allow you to book the seat for free, which is the only one is Emirates Airline. You can book the seat for free. You have Qatar Airways, Turkish Airlines. They don't allow it for free. You have to pay for it. The Egypt Air, you won't have access to your seating map. There is no access. You may try to contact the airline if you want, but right now, if you go to the website, that there is no access to your ticket information. You may also have access 48 hours before the travel. It should be available as well, inshallah. All of this just because this is a group booking, so it has specific restrictions. In regards to Saudi Airline, you have access to your ticket information, but there's no seating option available. Try to call the airline; they might be able to do it over the phone for you if you don't want a specific seat. Other than this, inshallah, you'll receive your tickets by early next week, and you should be all set. In regards to the smartphone, so smartphone is a must, as we explained before. Everything now on the phone. You need WhatsApp is a must to have in Saudi. All the communication with your group will be in the WhatsApp group, so it's very important to have all your documents. As we said, it's all e-copies. The visa is an e-visa. The ticket is an e-ticket. You can have a copy of your passport. All of this can be, inshallah, saved on your phone, just in case if you need it anytime, you can show it. Also, the Nusuk. So Nusuk card, as Brother Amr shared before on the WhatsApp, you will receive a Nusuk card, which will have your name, your company. There is a QR code if any of the security or the authorities in Saudi needs to recognize you or help you in any way. If you need any help, they can just scan the QR code and all your information will show up: your guide name, your guide contact information, the Saudi provider emergency contact information. All this will be on your Nusuk card. This card you will receive in Saudi, inshallah. So when you get, based on last year, we received it in Mecca. As soon as we get to Mecca, we receive this card. If you don't have it, you can log into your Nusuk, and you will have it as an e-copy as well. on your Nusuk application, the phone app. So not the website for Hajj, the phone app, and we shared the way how to register with it. You can also book extra Rawda visit on the app as well. So inshallah, it's easy access. If you need any help, feel free to reach out to Adam Travel Reps, inshallah. Packet Quran. This is inshallah. You have a long travel. This is one of the things that will help you on inshallah get the most benefits of your Hajj journey. Make sure you have a Quran with you during the travel. A dua list. This is also a lot of us. Alhamdulillah, we have families and friends that. Wants us to make dua for them, and we don't want to forget anyone, inshallah. So make sure you have your the names and the du'as you want to make. Also, there is a lot of du'as that, inshallah, if you don't memorize them, you can write them down and have them with you. Other documents would be some emergency contact numbers. For example, the arrival to Saudi. So you need to know when you get to the airport what kind of who's going to be helping you, or if you need any help when you get to the airport, inshallah, this is a good contact number to have in case if anything happened to you, may Allah forbid. You need to have the contact information for that person. The travel itinerary, we explained that. Also, Adam Travel will provide you with an ID. It will have the hotel names, the the emergency contact number, inshallah, to use, and we will update you on how you will receive this, inshallah. We'll start working on this by next week. The clothing and footwear. So these are also very important thing that you need to be aware of. A lot of you already started, purchasing these items. The ihram clothing for men. So the ihram, if your program start with Medina, inshallah, Adam Travel, when you are in Medina, we will provide the ihram for you. If your program start with Mecca, Adam Travel will provide you the ihram before the travel, inshallah. So your Adam Travel rep, myself, and the other brothers and sisters will be helping you, inshallah, and update you on the ihram if you're traveling with Mecca first. The abayas and the outer coverings for the sisters, this is gonna be your ihram for the sister. There is no specific ihram clothing, so make sure you have at least one abaya that to wear upon arrival to Medina or to Mecca. Especially if you're starting with Mecca, you may start your ihram on the flight. So in that case, you'll be wearing your abaya or any something clothes that cover all your body, inshallah. And when you get to Jeddah airport, you will before you reach Jeddah airport, or before you reach the miqat point, you start the intention. Now, outside the state of ihram, you can wear your normal clothing. Just make sure it's summer. It's very hot in Saudi. You make sure it's summery clothes that, inshallah, you want to be comfortable. Any kind of clothes for the men is anything that covering the awra, inshallah, would be acceptable for the sisters as well. You'll find if you have only one abaya, and when you get to Saudi, there are many shops, many options if you want to purchase from there as well. Comfortable shoes and ihram approved footwear. So definitely outside the state of ihram, you need something comfortable. Based on your program, some programs requires a lot of work, some don't. So make sure you have something comfortable, inshallah. Ihram approved footwear for the sisters. Inshallah, you will have this details and the specific requirements for the footwear by your scholar. I don't want to go into the religious part of it, but inshallah, make sure you have the proper one, and we will provide more insights by your scholars, inshallah, to make sure that you have the right footwear during the state of ihram. socks and underwear. That's something you will be using on a daily basis. So if your program is you know 10, 12, 13 days, make sure you have enough to cover you for the whole trip, inshallah. So it's summertime, it's hot, but sometimes it's at night time. It could get a little colder or before Fajr. So make sure you have like just a light jacket or a light sweater with you, especially in Medina. Usually it's a little colder during the night. Other than this, that should be it, inshallah. Now the personal hygiene and toiletries. This is also something you need to make sure you have. Some of these items will be provided by the hotels and by the Enmina as well, but make sure you have it before the travel, especially if you start uh, uh, with Medina and Mecca, both options, as you need to have toothbrush, toothpaste, floss, sunscreen. So sunscreen, that's something you should have um, the inshallah during, especially during the Hajj days. We'll go in the next slides into especially in Mina, inshallah, you will see it. Sorry, Stone, if you would just go back 1 second. Yes, just shampoo, conditioner, shower gel, all this. During the state of Ihram, as you need to make sure it's something that unscented if you want to use it. And then wet wipes and tissues, the same thing. It's a very good to have them during the travel on the plane, uh, just to keep, you can use them, inshallah, to keep your hands clean and sanitized. Deodorant as well, a hand sanitizer. Um, all of these items, inshallah, it's important to have during the Hajj travel. Now
All
the
right, Kinana, we're about to go.
health and first aid. Um, I believe we have Dr. Omar Hassad with us. Um, I don't want to spend too much time on this, inshallah. Maybe he can provide us with more insights as he's the expert in that, inshallah.
And Rami, did you? Yeah, we'll get to him once. Just continue, then we'll let him go in after you're done, inshallah.
Okay, because this was about the health. Okay, no worries. We'll go over this. Let's take quickly, inshallah. Jazakallah. So, in regards to the health and first aid, prescription drugs. So, this is a must to have, right? On the flight, make sure you have enough prescribed medicine on the flight. So, don't put it in your luggage, just in case, if may Allah forbid, your luggage is delayed or is lost for any reason, you need to have enough medication to cover you for the rest of your trip. And it's very advisable and recommended to have it in the original package to avoid any issues, inshallah, when you are traveling from the airport. Over the counter medicine, this is a lot of options, pain relief, all these kind of cold and flu and all of that. It's very important to have. Um, a lot of people get sick during Hajj, so it's important to have these kind of medicine. It will help you in your journey, inshallah. Electrolytes, plenty of fluids. This is something you should keep drinking. The hydration is very important during Hajj, especially now Hajj is in the summer. So make sure you have that with you, inshallah. Band-aids and antiseptic. So that's in case you get injured. So just make sure you have that as well. Lip balm, chapstick, same thing. Travel sickness tablets. These are just recommendations if you would need it. Immune boosters, you can start taking these from now, inshallah. Moisturizing cream, Vaseline, all of this is recommended. Face mask as well, and that would be the list of items. These are just the miscellaneous items as well. We shared it before. And a lot of these items are essentials to have in Mina, especially. The power bank. This is something you should have. Your phone has to have a battery at all time. So make sure you first thing you have a phone charger. You charge it. You can charge it in Mina, in Arafah, in Muzdalifah not. So that's something you need the portable power bank in Mina. In Muzdalifah. This is something will be very useful for you, especially if you need to get to your camp. All of the other items, I'm sure a lot of you got these items already. Water bottle, travel pillow, snacks during your stay, especially in Mina and Muzdalifah. This is very, very helpful. Sunglasses, a fan, misting fan, backpack. So some of these items also provided by the Saudi providers. Inshallah, we'll get you an update on the exact list that they will be providing. But these are the general items that you would need during the Hajj days, inshallah. Unscented sanitizer, the soaps, all of this, as we mentioned before. And I believe that's it. Inshallah, we'll share these items with you again, so you can take a look at it and make sure you have these items. And again, if you miss any of these items, if you did not purchase any of these items, inshallah, in Saudi, it's very, very accessible. There is a lot of local stores. There is a store called Bin Dawood. It's a big store, has everything. So inshallah, all of these items are easy to get in Saudi, in Mina and Medina and Mecca. I believe that was
Yeah.
it. Thank you.
Thank you,
everyone.
Rami. Thank you. This is actually, again, I think I want to re-emphasize that last point, Rami, that you don't need to, go to Walmart or Target and get a suitcase. Almost all of this you can get in Saudi, but this is all things that are essentially, and you can kind of go through and kind of get an idea of what you can get in Saudi and what you can't. So, and if you have any questions, ask your account rep or your guide about what's you would buy here. Maybe like a power bank was something I would get here versus Saudi, but the rest of it you can really get in Saudi. Yeah, that was wonderful. One last thing before we move on to the next part. I wanted to mention, of course, all of the welcome packages, whether it's the ihram, the neck wallet. So again, if you are whether Al Burj, Jamil, or Ithra, the way it will go is similar to how we did it last year. And we really operate by the flight you're taking, your international flight, because you're basically all on group flights. So if you are out of New York, Boston, Chicago, DC, LA, or Toronto, which is the majority of the people here are out of one of these major airports. I believe I'm not missing one. We're going to get the welcome packets ready, and we're going to ship them to the Adam Travel office a week before your flight. And what that means is, so if you live locally and you want to get it earlier, you can stop by the Adam office, give them your name. They'll look on the Excel sheet, find your name, check your passport, just make sure it's you, check off a box, and you can send somebody. It's not that serious. And they'll give you all of your things, inshallah, that you need for your journey. If you are taking a domestic or you can't make it to the Adam office, not a problem. For all of these airports, we're going to have a local Adam rep. We do that anyway, even for our Umrah, just to make sure everyone's checked in, and if someone has a problem, they have someone there to help them. And they will also have the items for you, and they will be there, and we'll give you their contact info before you travel. You can meet them at check-in and get your stuff before you check in. For those who aren't leaving from one of those major cities, and we're going to post it, inshallah, on the WhatsApp, we'll probably mail those to you directly, inshallah. That'll be the plan. But for everyone else, if you're flying out of one of those major cities, those are your two options, inshallah. And if any questions about that, we can save it till the end as well. Now, with that being said, I really have the honor. I want to welcome Dr. Omar, Dr. Omar Hassad. He's going to come and speak to you from the medical perspective on a lot of this. And we're going to do Majar and Mu'aysam, but the focus is always Mu'aysam's heavy, because Mu'aysam is the where it really can get taxing on your body, and he's going to give you more of the expert advice. We kind of give you the layman's advice, but generally speaking, The Umrahs can be, thousands and thousands of steps, whether it's your tawaf or your sa'i, and you're walking to the train station, you're waiting for the train station in Majar will be taxing. But really nothing kind of beats the Mu'aysam days of potentially walking from Muzdalifah to Mina, and then potentially in the Mina to Jamarat, and then potentially to Mecca if you want. And then even if you take a bus to Mecca, you still got to do your tawaf and sa'i. These days, really, that's the hardest couple of days, and people sometimes struggle to recover from that for the rest of their Hajj, because it's not like you can sleep in after, then you have 2 more days of long walks as well. So with that said, Dr. Omar isn't just going to talk to you from a medical perspective. He's been Hajj with us many, many times. He could actually, if he wanted to, he chooses to go as a pilgrim. He could be a guide easily for any of these groups, but he likes to go as a pilgrim. And honestly, he ends up doing the work of the guide half the time. Whether even last Umrah, I told him, brother, we have a guide, but he's very knowledgeable. And what's important is from both, because you really need both perspectives. You need the textbook medical perspective, but also someone who's been there and who really knows what he's talking about. And that's why he's really the perfect person to come talk to you. It's a no-brainer. Dr. Omar, we want to thank you for taking time out of your day. He will also be joining you for Hajj, inshallah, as well. And go ahead. The floor is yours.
Assalamu alaikum, brothers and sisters. Jazakallah khair, my brother Muhammad. It's a pleasure to be with you all. Alhamdulillah Rabbil Alameen. It's with the blessing of Allah subhanahu wa ta'ala. I've been doing this since 2014, 15. So I've been going to Hajj and Umrah, and sometimes even twice a year. So thanks, alhamdulillah, Allah subhanahu wa ta'ala allowed me to do this. I'm a clinical pharmacist. I've been doing this since 1999. So I have, alhamdulillah, a lot of knowledge, and I try to help people as much as I can when I'm there for Umrah or Hajj. So I'm really accessible, and I'll be able to help anybody who needs help, inshallah. I'm going to start chronologically how, there's one thing that you guys talked about, which is the meningitis vaccine. There is one issue that just got missed. I want to make sure that everybody are aware of it. When it comes to the meningitis vaccine, ensure that you have the meningitis vaccine, you received it at least 10 days prior to travel. And no later than 3-year-old. Like, you cannot have a vaccine that is like from 5 years ago or 6 years ago. They might not accept it, so don't risk it. Ensure that your records that you're getting for the meningitis vaccine is, a maximum 3-year-old record, and no later than no less than 10 days prior to travel. The pharmacies that you get the vaccine at, whether it's Walgreens, CVS, or your local independent pharmacy, they will give you a receipt for that. It will have your name, your date of birth, and it's the vaccine that you receive, which is the meningitis. And sometimes this meningitis is referred to as the ACYW, which is the same as the meningitis. Just for record's sake and house cleaning, just make sure you guys have that knowledge. The other thing I want to make sure that, as far as the medication, Brother Rami had touched on that. Ensure that you get a fresh labeled medication. If you have medicine from 6 months ago, a year ago, try to get in something more recent, more fresh labeled medication. It just helps with that. The other thing that you want to make sure that, write on a piece of paper the list of all the medications that you take, the allergies that you have, whether it's allergies to medication or allergies to food, and ensure that you have that laminated and have it with your NUS card, just in case, la samahallah, something happened and I need to help you or somebody needs to help you. And we know what we're dealing with, along with the disease states. Like for instance, I get kidney stones. So if somebody find me in pain and they don't know that, and I'm complaining from the back, my right side of my back, they're going to think I have messed up my back, and it might not be the case. It might be just a kidney stone due to dehydration, accumulation of calcium. So ensure that is in place, please. And make sure that if you're taking like insulin, if you're taking medication that has like liquid, but it's properly labeled and properly stored. Insulin need to be in it has to be in a cold temp. And so make sure that it's labeled properly and stored properly. It makes it easy when you travel, when you pass security lines, so they don't question you due to volume restrictions or whatever the TSA have in place. The other thing I want to make sure that you guys, there's a lot of times people, like I said, allergic to certain things. You have an EpiPen with you if you're that kind of person. You might be allergic to kiwi, and you by mistake you ate kiwi and you develop an allergic reaction. So ensure that you have an EpiPen. It is very difficult to get an EpiPen in Saudi Arabia. I just want to let you know right now. Yeah, there's a lot of stuff readily available, but when it comes to medication, it's not the case. So there's a lot of restrictions, and it just makes it difficult. Same with inhalers. If you're an asthmatic patient and you take inhalers like albuterol, a bronchodilator, please ensure that you have all the inhalers that you need available for you, because you might not be able to get them in Saudi Arabia. And if you lost it or something like that, you have to be seen by a doctor before they even dispense it for you. Tylenol, as far as for pains, just have some bottle of Tylenol. They do have it readily available in Saudi Arabia, paracetamol and some ibuprofen, just to help with the aches and pains. And if you develop a fever, Tylenol will be helpful. One of the things that Brother Muhammad had touched on is the walk-in. It is very important that that you have to stay hydrated. So ensure that you have some salt tabs, so this way you could retain the water and you don't get dehydrated. And take some magnesium tablets and potassium. That will help if you prevent leg cramps, so you don't get leg cramps from walking and you're dehydrated. The other thing that I see common, that when I go there is people develop diarrhea, whether it's a traveler diarrhea or whether it's just a change in temperature going between the tent where it's the AC and it's cold and outside is hot. That change sometimes just end up leading to developing people just diarrhea. So make sure you have Imodium. It's over the counter. It's readily available. It is cheaper here than it is over there. So you could just make sure you have a box of 24 just to help you out. You could take 2 at onset, then 1 every 4 hours till that case subside. The other thing is just cough. The change in temperature does end up get people to tend to develop a cough. So just have some cough medicine, some lozenges to help you keep the saliva moist. It just helps. Make sure you have some face mask. It does help, so some people don't like it, but it really does. When there's crowds and all that, you want the least amount of exposure that you get to other people. Alcohol hand gel, just make sure you have a small one just to sanitize your hands at any given time. Vitamin C, they do sell it over there also. It is a little bit pricey over than it is over here. I would take 1,000 units of the vitamin C daily. You cannot overdose on a vitamin C. Vitamin C is a water-soluble vitamin. If you take the entire bottle, your body will just take what it needs and flushes the rest. So you can't overdose, but the minimum needed is 1,000 units daily, every day while you're there. I highly suggest you start 2 days prior to traveling, and when you come back 2 or 3 days after, just to keep your immune system at high levels and boosted. The other thing that I want to make sure that you guys make sure you have like a first aid kit, some bandages, stuff, small one, just in case you get a blister, what have you, just so you could take care of yourself. A lot of from all the walking you're going to do, a lot of people tend to, their feet, they tend to crack their heels and stuff like that. The solution for that is just having like an Aquaphor or urea base cream or ointments. That will help tremendously, and it helps with the healing process. Vaseline is a must. I'm telling you, from experience for us and men, it's a must to have. Just reduce the friction from walking and prevent heat rash. You do not want a heat rash. It'd be a nightmare. Yeah. So the other thing, make sure you have unscented wipes. It's just sanitary, and it helps, especially in Mina and Arafah and Muzdalifah. Glucose tablets is something that we should, have just at least 1 bar, with 1 stick with you, just in case you need just a boost in your glucose levels. The other thing that I want to say, that Voltaren gel, that's just to help with the pain. It's a topical non-steroidal anti-inflammatory. It is available over there, but it's pricey over there. It is cheaper here. You could just get a tube from over the counter. It's like $10, the generic diclofenac. That will just help with the aches that you get, the muscle aches. The other thing that I want to make sure that, take some Benadryl, just it helps, just in case you develop just some basic allergies or some case of just mild allergic reaction. And antibiotics. Antibiotics in Saudi Arabia are prescribed by prescription only. It's not, you can't walk into the pharmacy counter and ask for an antibiotic. They're not going to give it to you. You have to be seen by a doctor. So if you're able to get some of the most common antibiotics is, like, for instance, Z-Pak. That's used for upper respiratory infections. Augmentin, that's used for sinus infection or ear infections. So if you're that kind of person that's prone to these kind of things, make sure that you have some on you. The other thing is, for the sisters, so there's medication that can be prescribed for menstruation. So just to prolong it, so that for that time of the month, so it doesn't happen while doing Hajj. It's like for one of the medications called Provera, for instance, or Agestin, that can be prescribed by the doctor or OB-GYN, and that will at least prevent the sisters from having to deal with that during Hajj. And Provera, the generic medroxyprogesterone, it is cheap, readily available. It's way easier to get it here than to get it in Saudi Arabia. So just make sure that you get that taken care of here before you go. And just be mindful that there is a lot of walking. It is the summer, so it's going to be hot. You're going to be dehydrated. Please ensure that you're drinking plenty of fluids, and fluids that matter: water, juices, electrolytes, that will actually help you. And so you can sustain the time you're there. And I will be personally, inshallah, in Burj 10. And if anybody need help with any of the groups, regardless whether it's Burj 10 or any other group, I'll be there. I will have some medications with me, inshallah bil alameen, try to help who I can help. But I can't have a lot. Just as much as I could take, I'm going to take. So if anybody need help, don't hesitate. I'm here for all of you, inshallah bil alameen. And with that, I'll leave it with Brother Muhammad for Q&A.
Dr. Omar, I'm going to thank you, first of all. Thank you for all of that. And I'm going to kindly ask you, I believe there's going to be some questions directed at you. So thank you for staying a little bit longer for the questions. And I would ask, so we don't take up too much of his time, when we start the Q&A, those who have questions for Dr. Omar, raise your hand first now. And then we'll start with those that way. And then when he finishes, we'll take the regular Q&A, inshallah. Just want to add to that. If you do have, I've been Hajj many times, and really I've seen it all. So if you do have, alhamdulillah, if you do have health complications, if you do think that these, especially if you're in a Mu'aysan package, that means Al-Burj 11, 12, 17, 18, right? Those especially more so than the majority, to be honest. If you do have health complications, you need to let your guide and account rep know we are here to help. We want to make it as smooth as possible for you. But what's the scariest part is, our level of care as Americans, right? It doesn't always match what you get over there. And so what we take seriously isn't always taken as seriously over there. And when you're in Arafah, or it's late at night, and you're exhausted, or you're in Muzdalifah, it's really, really, really hard, even in Mina, to be honest, although there is a doctor's tent in Mina, to get you proper medical attention, to you know what I mean? And it's scary, especially when you're in Arafah or Muzdalifah, and it's impossible to get an ambulance in there, and it's really hard to find doctors or to find the medicine you need. So if now, of course, qadarullah, not every, you can't predict these things. Sometimes, some people, just perfect health, and something bad happens from the stress of Hajj. That happens. But if you suspect that you could be susceptible to the stress of the heat, like Dr. Omar said, the change in temperature, all the walking, all of this, if you think this might be something that might wear you out, let us know before, so we can prep as much and take extra care with you to make sure that we don't, as best as we can, we don't fall into this area where you're in an area where we can't really get you help and you're struggling, right? Even if it does seem like, you'll be fine, it's a scary situation for everybody. So we try to avoid that, and we try as best to kind of, make it, everyone says, oh, you make it so gloomy and so scary, but we just want you to be prepared. We want you for what you're coming up to. Everyone should be at now. I highly recommend, taking a lot of steps, trying to get 10 to 20,000 steps every, 3 or 4 times a week. to get your walking. I'm doing it myself, taking long walks to get ready. And if you want to walk in slippers, because you'll be doing that to get your feet prepared. Try to spend time, honestly, in a sauna or steam if you have access to it, getting used to the heat. If you're not used to heat, get your body accustomed to being in heat. Get yourself as ready as possible for what's to come, inshallah, because you will be doing Hajj in the Saudi Arabian summer. So we do our best, and even the Saudis, everyone does their best to work around that, but it's hard to escape that unavoidable fact. With that said, I'll start with the questions. These are going to be for you, Dr. Omar. Brother Abdul Shadri, go ahead. Brother Abdul Shadri?
Yeah, assalamu alaikum. Yeah, my system was unmuted. Now I'm unmuted now. So my question was that my flight will be having a layover of 6 hours in Doha. So if I plan to make the ihram from Doha, then there is a provision by these 6 hours I can take shower somewhere, keeping my hand luggage safe, or the thing that only at the time when a miqat announcement will be done, then I should take the ihram. Even then, I believe that before that, the shower is a must. So is there any facility will be provided to take a shower, bathroom facility or anything? Is that possible in Doha in the 6 hours layover time?
Dr. Omar, I don't think this is a question for you. We can, anyone from the team that wants to handle Doha layover? Besides that, I mean, someone wrote in the chat, there's lounges in Doha, but I believe for those who don't have lounge access, of course, you have access to a lounge, whether it's through Priority Pass or if your business pass, they use a shower. But I believe you can certainly put on a ihram at Doha Airport. I do believe they have shower facilities at Doha Airport. So you can just ask when you arrive for the shower facilities. Thank you, Rami. And you can and use the showers there and put on your ihram in Doha, inshallah. And for those who have long layovers and got group 3 seats through Adam, for the El Burj folks, I believe for Turkish and Emirates, speak to your account rep. As we get closer to travel, they'll inform you of the hotel process for your hotel layover, inshallah. Those don't get booked. It's just kind of like your ticket gets allowed to booking that day of when you arrive there. So you just kind of go to the hotel desk, show them your booking, and they give you your hotel, inshallah. But we'll walk you through that, inshallah.
So you mean to say in Qatar Airways for 6 hours, there is no chance of hotel, 6 hour layoff time?
No chance for what, brother?
Getting hotel.
Muhammad, if you allow me Muhammad, just allow me to answer this question for the layover in Doha. So if it's less than 8 hours, there's no hotel. If you are 8 hours or more, you are qualified to get a hotel stay in Doha Airport, and we already sent the rooming list to to Qatar Airways. And as soon as we receive the approval, we will confirm with everyone who has 8 hours or more layover, inshallah.
So obviously I have 6 hours. So for me, there is no hope of hotel. So I understand that I'll have to take in the airport, ask them that where is the shower facility. And another question is that.
Excuse me, can I help with this question?
Go ahead, Brother Ahmed. Go ahead.
There is a lounge there called Al Maha. You can actually reserve a spot there online. It's a little bit expensive, but I think it deserves the money. You can have a shower there. You can have a meal. You can put your ihram clothes there, and then they will take you from the gate to the lounge and back to the gate that will take for the plane going to Mecca. I think you are with me in the same trip, so I would suggest that you look for Al Maha lounge in Doha Airport, and I am sure you can. Even I believe if you try to book to choose your seats, there is a link for Al Maha lounge there. You can click to reserve your spot. It's a very simple process. It's little, as I told you, it's just a little bit expensive, but it deserves the money, I think.
How much is the expense involved?
I don't really recall, but it's probably around the $200, probably, but I'm not sure.
Okay.
There is more. There is another. If you want like more comfort, there is another one called I think Onyx. It's like a hotel, but that's for the business class.
No, mine is ordinary class, economic.
No. I'm saying the level there is for business people. I should say business people. Yes. So Onyx is another option there for you if you want to have it. That's up to you.
Okay, fine. I understood. So can you please, Al Meher, what you told is for everyone or only for business class again?
No, for everyone. I'm
Okay.
not business class. I just reserved it. So.
Okay, so mine is Al Burj 12 from Chicago. Are you by the same flight?
I am the same flight. Yes.
Mashallah. So in the airport also I can take your help.
Inshallah.
And prior to that, we'll have to book it. So how can I get the exact Meher link or something like this?
Look for Al Meher Lounge online.
We'll send you, inshallah, the information how
Jazakallah
to get
khairan, Rami.
to it.
Brother Sadri, I can call you after the meeting and I can give you the link to the website of Qatar Airways. Don't worry, inshallah.
Jazakallah khairan.
Jazakallah khairan. My question.
Okay.
Thank you so much.
Thank you, Brother Abdul. Brother Mike Barakat.
Sorry, I'm not sure if we were going over the questions versus the.
This is supposed to be the medical portion. Questions
Okay,
for the Omar
perfect.
portion. Yeah.
All right. The medical question is for Brother Omar. You mentioned Vaseline. Can we replace it with anti-chafing, or is that the purpose of the Vaseline?
Yeah, it's just to reduce the friction and you prevent heat rash. Correct.
Got it. Is there a specific brand you recommend for anti-chafing?
No, just the plain brand name Vaseline. That's what I would use. It's like a couple of dollars. That's it. That's all I would use. And you don't need to get a big jar, really. You just need, something small.
Got it. Thank you.
Mm-hmm.
HS, go ahead.
Jazakallah khairan, brother. I was wondering what antibiotics that the doctor was mentioning.
Yes. Like I was saying, the most common antibiotics when you're traveling that you will end up needing are really three. Number one, people who develop upper respiratory conditions. And most likely the upper respiratory condition, you develop them because the hot, cold, that change in temperature, it settles in your lungs and you have an upper respiratory infection, possibly a pneumonia. You need a Z-Pack for that. Azithromycin. It's a course of 6 tablets. You take 2 tablets day one, then 1 tablet daily for 4 days afterwards. So it's a 5-day course. And you could even take it faster where you take 2 tablets daily for 3 days. In Saudi Arabia, antibiotics are per prescription only. You cannot walk into a pharmacy and ask for it. Unlike some other countries overseas, like Jordan, for instance, you could just walk in and get it. Saudi Arabia, you can't. You have to get a prescription from a doctor. It is very, very difficult to get even telehealth during Hajj. It is not simple. So just come prepared. I would ask your primary care doctor to give you a prescription for Z-Pack just to have it on hand, possibly Tamiflu just to prevent, in case you get a flu-like symptoms. And you have to start early on that. The onset is within 24 to 48 hours when you start feeling that flu coming down, and start taking the Tamiflu along with a Z-Pack. The other thing is people sometimes develop sinus infection, ear infection. Augmentin is, there's a generic for it also, 875 milligram, 1 tablet twice daily for 10 days, take it with food. Same thing, just make sure you have 1 bottle in hand. The last antibiotic that's really overlooked is ciprofloxacin. That is very helpful with traveler diarrhea. It's almost impossible to get that in Saudi Arabia without a prescription. So those are the antibiotics that's needed. Just make sure you have them on hand. The other thing that I did forget about is people who have glaucoma or have eye condition. Just make sure you get your eye drops with you. And there's certain eye drops required to be refrigerated, and it has to be at a cold temperature. Ensure that that cold chain stays intact.
Well, Jazakallah khairan. Can you drop that in the chat, please?
Yeah, sure.
Those 4. And then the other thing is that I took the vaccine for the meningitis, and I got a handwritten note basically saying, "Okay, you've taken it." Is that official? I mean, that just
No,
seems like
it's
anybody could
not.
write that up.
It's not. You have to get. You have. Let me show you guys. I'll show you something. I don't know if you see it. Let's see if you see this. What you need is something like this. This is from. Let me flip it upside down. This is from Walgreens, for instance, that shows the COVID. That's what you need. You need that receipt from Walgreens that you got the meningitis, or CVS, or Costco, Jewel, whatever it is, or Costco, whatever pharmacy. All they have to do is reprint it. They never lose that data. The data is there. If you lost it, just go ask for it. They're reprinted. You just have to show that. That's it. It has your name, date of birth, and the vaccine that you received, whether it's the COVID, whether it's the meningitis. And like I said, the meningitis, you cannot, if we leave in the 30th of May and you go get that meningitis vaccine May 25th, it's not, you're defeating the purpose. It has to be 10 days at least prior to travel, you know what I mean? Or longer than that, you know? So the time is 10 days prior to travel that you've taken the vaccine, up to 3 years. You know, it's a quadrivalent. There's another variance of it that could be up to 5 years on the safe part. So nobody stop you, nobody question you. Sometimes it just gets iffy with these, you know, I mean, border security officers in Saudi Arabia. Just make sure that this fits the parameters, so they don't get like us, like, oh, you just took this May 25th and you're telling me you're traveling. Really, they could actually deny you entry. I'm telling you right now. There's no reason for you to do that. You know what I mean? If granted, Muslims sometimes don't know what they're looking at, you know, just to be honest. But if you get somebody who's just trying to be a pain, they could make it difficult. So make it easy for yourself. Just ensure that you have it no later than May 20th, and you already had it the maximum 3 years ago.
Jazakallah khair. But you know, I can get a printout from my healthcare provider, and that should be sufficient.
Have him stamp it and sign it.
Oh, you want them to stamp it? Oh, okay,
And sign it. Yes. Otherwise, they're not going to take you seriously, because anybody could actually reproduce that.
Right.
But if it's stamped and signed, it's acceptable.
Got it. Even though they don't understand what they're looking at.
It has to have your name that matches your passport, and it has to have your date of birth. Those are the two things that has to be there. Name exactly how it is on the passport, and the date of birth that matches the passport.
I see. I got it. So there's this MCV40. Is that making any sense? That's the MENVEO. That's the one I got. Yeah.
That is a form. That is it is acceptable too. There's multiple ones. There's, like I said, you have the ACYW, the MCV40 is called the ACWSNY. It's the same thing. It's acceptable. Yes.
Okay. Jazakallah khair, brother.
Yes.
Brother Ahmed, do you have a question, or are you just raising your hand to help Brother Abdul Haq?
No, actually, I have some questions.
Go ahead.
One is, Dr. Omar kind of confused me when he said that the proof of meningitis vaccine should be stamped. All the big pharmacies here, CVS and others, they give just the receipt. There is no stamping or anything like that. Is that acceptable?
Brother, that stamp, that's because he's getting a note from the doctor.
Oh, got you.
That is totally different.
I'm sorry. Now, the other thing is, as you know, you can walk to any pharmacy and you can ask them for a list of the vaccines that you got, let's say the past 10 years, and they can give you a full list. Would that be acceptable proof for COVID, for example?
Yes, it is. As long as it's the receipt that I showed you from like Walgreens, CVS, whatever.
They know them.
Albertson. Yeah, it's acceptable. I actually did that for the Hajj that I went last time, for the Umrah, and no issue at all. Just the dating. As long as the dating is good, you're okay.
Now, another note here. I actually hear that Vaseline is in boycott list. So if you have alternatives for it, would be great to mention it now, so that we can use the alternatives if possible.
Yes, sure. Aquaphor is very good lubricant, and it's a healing ointment, and it can be used actually.
If you can put it in the list, I would appreciate it.
I'm typing the antibiotic right now. It'll be next on the list, inshallah.
Jazakumullah khair. Now the last question I have is, actually I have two questions. The second last is, I hear a lot about unscented. Is it because of fiqh reasons or because of something else?
I'm not a scholar, you know what I mean? But I'll tell you, from traveling with scholars, that's what I've been told. So I'm not going to make a statement regarding that. It's just
no, it's not you. It's everyone is saying unscented. I just don't know if it is because of a fiqh rule or is it because allergies and stuff like that?
No, it's because of the fragrant. That's what it is.
I see. Okay, and this is, I believe, would be only during the ihram type.
Correct.
Got you. Okay. last question, and it's kind of like tough, so bear with me.
It's okay, go ahead, Amir.
In your 10 years of experience doing Hajj, I think you said 10 years.
Yes.
Have you seen any death cases among people going from here during the Hajj? And if yes,
I
what are the
did.
reasons?
Yeah, I did, but it was not with the group that I'm in with. It was in passing. You know, I've seen it in passing. And I actually tried, I stopped to help, but the problem is I couldn't help. I'll tell you why. Number one, I walked into, a brother, and he's, I checked for his pulse, everything's gone. I didn't know what I'm dealing with. I don't know what health condition that he had. He did not have a proper card that tells me what medical condition he has, what allergies, what's going on. And the people around him, they didn't seem to give me a full story, what transpired for me to help. What led to this? But from what I gathered, it was pretty much, end up being he had a heart condition, he was dehydrated, and it was an accumulative of a lot of things that just took a toll on it, and just the body gave up.
Doctor,
So
can I
in 10
add to
years,
this? Because I've witnessed about a handful of deaths. Last year, someone from Al Bayt from Australia passed away, and we were with Al Bayt from US, so we witnessed this. And the last 10, 12 years, not alhamdulillah, not with us, but there's been deaths with companies close to us, people we've seen, and almost all of them, without any exception, it's the exact same story that you just said. It almost always happens on their walk to Jamarat. They get lost on the way back, and they get lost on the way to Mecca. They're not prepared for the walk. They don't realize how tough it's going to be, and it's dehydration and heart, and they collapse, and they don't get revived fast enough because of the crowds, and they pass away. And so that's why that is the worst case scenario here. So yes, it's almost all the same story. And I think the takeaway from that is when you go to Jamarat or when you're getting ready for a walk, don't go anywhere, especially in the days of Mina, where you don't know exactly where you're going and have a plan on how to get back. Because they almost all, sorry to interrupt, but that's almost always the same story. Go ahead, Dr. Omar. Sorry about that.
The other thing, brothers and sisters, I want to make sure you know this. If you have a health condition, whether it's COPD, asthma, heart condition, I really highly suggest do not attempt to do tawaf in the plate, sahan, close to the Kaaba. It is tough. During Hajj, it is extremely tough. Granted, I'm young and I felt it, but it feels like sometimes that your chest is being crushed for the amount of people that's there. Please do it on the second floor or the third floor, which is, I know the circle is bigger because as you go further away from the Kaaba, but let me tell you, I did it both ways. It took just as long. It's the same time. You're not saving time by being closer to the Kaaba. You're still going to have the view of the Kaaba, inshallah, from the second floor or third. And for some people who can't even do the tawaf, me and Sheikh Tariq, we have actually tested those I call them go-karts, the electric, carts. They actually work. Just go ahead and just rent it and pay for it. And you sit in it and do the tawaf that way. Allah subhanahu wa ta'ala inshallah accept. You just, because your health condition doesn't allow you to walk.
Okay, and I'll add to that before we go to the next question. Quick anecdote, just while we're on this topic. Even my personal story, when you're going through these walks, don't just listen to your body, listen to your mind as well. And what I mean by that is, for example, one of my relatives, he was elderly, he went Hajj with us last year, and we did the walk and he felt great because his adrenaline was pumping, it was Hajj, and we finished the whole walk and we got to Mecca, and he said, I'm feeling good. And I said, you should probably rest for tawaf. And he said, no, let me get it done. Because it's 10 Zulhijjah, and I want to get it done. I want to get my tawaf inside done before I can relax. A lot of people have this mindset. And he didn't rest, and I recommend always is if you're rest for a few hours. Because if your mind tells you, if I just walked all of this, I should probably rest. And sometimes your adrenaline has you do things that you probably shouldn't. And he didn't feel it then, but his leg was injured from that walk for 6 months after. You know what I mean? So sometimes the consequences don't come right away. And sometimes you don't feel it. So even if your adrenaline's up and you feel like you can do it, you just always be safe, take extra breaks, plan your breaks, and take rest when you can, inshallah. Even if you don't feel it at the moment, but if your mind tells you I've done a lot, I should probably rest, then do it. Brother Basir al-Haq, go ahead.
Assalamu
Islam.
Yeah, my question is, my doctor recommend us to take typhoid vaccine or the capsules, but we went to place and our insurance does not cover.
Yeah, the 4 capsules. I know what you're talking about.
So
Yeah.
is worth it to pay $150 cash each one, or what's the recommendation?
Here's my take on that. You know, when it comes to typhoid vaccine, you go to Saudi Arabia. That is not a region that's known for that. You know, if you want to do it just from a precaution because there's all kind of walk of life are coming, you can. But Saudi Arabia is just not known for that kind of issue. The meningitis is the #1 issue that they had in COVID. So those two things are take precedent over the typhoid. So I personally, from my professional opinion, I wouldn't. You know, I mean, it's just I don't see the need for it. But if you want to be extra cautious, go ahead. Yes, it's a personal decision. Then.
Yeah, I think we go in the same direction. My second question is, if I walk a lot, sometimes my foot hurts. Is anything I can do it? I asked my doctor. He said, "Oh, you don't have pain now. I cannot give you."
Tell me which part of your foot you're talking about.
Is the heel.
Oh, the heel. Yeah. Okay, that's fine. So, do you have any arthritis? Do you have any issue? Do you have gout? Do you?
No, I do have. Doctor always say I have 5% arthritis because I got from my mother.
Okay. Prior to doing that, prior to doing any walk-in, take a leaf, which is naproxen sodium, which is over the counter, or even ibuprofen. Take like at least 400 milligram. Make sure you have something in your stomach prior to starting any kind of activity like that. That will help decrease the inflammation or any pain that you might experience.
Okay, that's a lot.
Yeah, Brother Saad.
Assalamu alaikum, ikhwan. The only question that I have is the only vaccine that we need to have is just we don't need to do COVID.
We lost you, brother. Go ahead.
Go ahead, Saad.
Can you hear me now?
Yeah.
Yes.
Okay, so the only thing that I want to confirm is the only vaccine that we need to have is for meningitis. We don't need to have COVID or anything else that is required for entry into Saudi, correct?
So for the brothers that don't know, Saad is actually my brother-in-law. So Saad, so in this case, yes, you need the meningitis, but just have Walgreens reprint that COVID vaccine for you and your mother, and just have the receipt with you.
Okay. All right.
That's it. It's the receipt for the either COVID #1 or #2. I know she's a reboost. You got boosted, so or both of them, and that's what you need. Just those 3 things.
Okay, inshallah.
Inshallah.
Okay, thank you.
iPhone.
Yeah, I was talking on a muted phone. Sorry about that, but thank you for taking my question. The question that I have is that you guys, I heard somewhere that you could take Vortex or biofreeze type of things, but those have a smell on them. So if I get them, I can apply them even though they said that not to have anything with fragrance, or that will not count as fragrance. The minty, strong smell of those things.
Yeah, it's biofreeze. Yeah, a lot of chiropractors use it for muscle pains and aches. Actually, it does work. It does help quite a bit. The take on that, you know what I mean? It's for medical reason. If you're doing anything like, you know, for medical reason,
okay,
it is the status is exempt from that, so you're allowed to do it. For that's what the scholars have said. The one I've been to Hajj and Umrah with. If it's done for medical reason, it's okay. If you're doing it as a cosmetic or something like that, you know what I mean, then it's not allowed. But if you are really in pain and you need to apply some biofreeze rub-on, and by the way, I suggest you buy the roll-on, the biofreeze roll-on.
Yes,
those are
yes, at Costco. They have them on sale right now, so I could go
for
get
$10.
them.
Yeah, they're cheap, you know. So, but it does work, you know. But if you're doing something for medical reason, our religion makes everything easy. You're doing it because you want to have fun or because it's accessory. It's for medical reasons, so it's exempt. Inshallah.
Got it. So like the intention. And also this, well, no, this is not medical, so I'll wait. Thank you so much.
Sure, thank you.
Okay.
Brother Wassam?
Assalamu alaikum.
Alaikum assalam wa rahmatullahi wa barakatuh.
Doctor, do you recommend taking the pneumonia vaccine?
How old are you?
46.
46? Yeah, the guidelines when you turn 50, it's a mandatory, and you could take it again when you turn 65 again one more time. It doesn't hurt to take it, to be honest with you. It's not a mandatory thing, but if you're prone to getting upper respiratory infection or pneumonia, yeah, I would. If you have risk factors.
Yeah, the doctor recommended for
Yes.
me.
If you have it, then he knows best because he has your medical history. He knows everything about you. So if he recommended it, then I would do it. Yes. That means you most likely you're predisposed to it and you have risk factors. Then I would do it.
Okay, inshallah.
Inshallah.
Brother Anwar? Brother Anwar?
Assalamu alaikum, Anwar.
Alaikum assalam wa rahmatullahi wa barakatuh.
And how I can get the electric chair or electric car, whatever, for tawaf?
Oh, it's you have to buy the ticket for it. And I honestly think that's going to be Adam Travel could help you locate, tell you where they're at. I don't know where they're at, because they're the one who did it for us. So I can't speak on that.
Reach out, Brother Anwar, to your account rep, and he'll give you the information on that, inshallah, and the links to that. And also your group leader should be able to help you with that as well, inshallah.
Okay, jazakallah khair.
Brother Ali?
Assalamu alaikum warahmatullahi wabarakatuh.
Assalamu alaikum wa barakatuh.
Yeah, my question is on the COVID vaccine. The last dose I have was 2022. Is that okay?
It is okay.
Okay, because I had the first one in 2021, which is the first and second, and then
It's
the
the
last one
booster.
was
It's the booster. You got the second one. Yeah, that's fine. Just print both of them and take it with you. That's it.
Yep,
Both of
I
them.
have the CDC cards. Yeah.
That's it. That's all you need. That's good enough for both.
Oh, okay. Jazakum khair.
Jazakallah.
Sister Zainab?
Assalamu alaikum.
Alaikum assalam wa rahmatullahi wa barakatuh.
My question is for the management. I have a question that you people mentioned earlier that haram view rooms will be provided at additional cost, and I never heard anything after that. So what about that?
Sure. Send a message to your account rep. We're still waiting to hear back from the providers about when they hear back from the hotels regarding availability. So message your account rep privately, and they will get back to you if it's available, and if so, what the extra cost will be. Sounds good?
Okay, sure. Thank you.
Okay, you're welcome, of course. Brother Anwar, is this medical or is this? Okay, we'll pause here. Dr. Omar, I want to thank you. I think all of you now can tell the difference between the layman's talking, giving you guys medical advice versus the experts, alhamdulillah. It's much different. So wallah, your expertise is valued and much needed. If you're still here, if there's more questions, we'll throw them your way. But Dr. Omar will be with us for Hajj, inshallah. And so will also one of our guides, Dr. Ahmed Yusuf, with Al Burj 10, is also a licensed doctor. And he as well will be with us for Hajj, inshallah. So there are doctors available throughout the programs, but more importantly, there's also a doctor's tent in Mu'aysam, for those in Mu'aysam as well, and I believe in Majar as well. So you have access to medical professionals there as well. The only time really that the Hajj providers don't provide as much medical attention is Muzdalifah is hard, and Arafah can be difficult as well. That is the most critical times when there's not as much doctors. But beyond that, everywhere else, there are doctors present, inshallah. Again, big heartfelt thank you from us, Dr. Omar. I have a strong feeling these questions are for you as well. But just in case, thank you for coming in here and helping us with your expertise. It's appreciated. Thank you. Brother Mike, go ahead.
Yeah, so I'm not sure if I missed it, but since we're going to be there in the summer, Are there any umbrellas being given away? Do we need to bring our own umbrella? Are we, for the majority of the trip or the walk, are we walking in the shade or are we walking under the sun?
Good question. Umbrellas, I believe Al Burj will provide one for you in their welcome packet. It won't be in ours, but Al Burj will have a welcome packet along with Jamil will have one, Attar will have one, and they usually include umbrellas in them as well. Otherwise, if they don't, they're very easy to get. They're everywhere. They even give them away when you're walking in Mina. But in regards to which parts are shaded, when you're walking to Jamarat, are you in Muaysam or Mazar?
I'm not sure. I'm in Ifrat 22.
That's Muaysam. So when you're walking to Jamarat, the first 10 minutes of that walk is unshaded. The other 30, 40 minutes of it is shaded. And then the walk into Jamarat is also shaded. So I would say 80% of that walk is shaded. If you try to walk to Mecca, which some do, that portion of the walk is about, as you get close to the Haram, is about 25% unshaded, but the rest of it is in a tunnel as well. So it's not a ton. Probably the one that's the area where it's most uncovered is if you try and do tawaf in front of the Kaaba. That's really the only area that's unshaded for where you'll be walking for an hour. The majority of it is shaded, provided nobody gets lost or takes a wrong turn. You know what I mean? If you follow the guides and the team and you follow the roads you're supposed to go on, the majority of them are shaded. But there are people have gotten lost and they end up in a sunnier area, which is scary. Does that answer your question?
Yes, and I guess we should get sunscreens with us. Is that allowed as long as it's not scented?
Yes.
You don't have to bring it. You can absolutely just Bismillah. You can absolutely buy it there as well. They have it there, but yeah, you can bring it as well.
Yeah, they have plenty of pharmacies there. The main brand name pharmacy, like how you guys know Walgreens, CVS in the state, they have something called a Nahdi. A Nahdi, it's everywhere you walk, you'll find a branch. It's literally, there's like one across from another one. It's like, that's how frequent you're going to see one. And they do have a sunscreen, they have everything. They even sell umbrellas, they sell wheelchairs, glucose tablets, salt tablets, vitamin C. They have a lot of stuff.
Got it. Thank you. I have one more question for the SIM card. I'm bringing a older phone that doesn't have any of my data on it, and planning to get a SIM card, but it's an older phone, and so it requires having a physical SIM card. Is that still available in Saudi, or
Yeah,
do they only
absolutely.
provide
At the
the-
airport, if you have a copy of your passport and visa, you can get it in any one of your the cell phone stores they have all over the Haram.
Jazakallah. Thank
you. Brother Amru, you want to take the next couple?
Thank you so much, Muhammad. Thanks so much. Yes, of course. Brother Minhaj.
Assalamu alaikum.
Walaikum assalam wa barakatuh, brother.
Hey, brother. So I have a few questions. So my first question is, can we use our US debit or credit card in Saudi?
Yes, you can. You can use the credit card and debit card, credit card over there. Yes, you can.
So I can avoid bringing in any cash, or I just basically can use my debit card like I do
It's a
in the
credit
US.
card. Yes, yes, you can use it. But as a brother Rami's already mentioned that, and I was already explained that to everyone. Yes, you can. You can use the credit card over there. You can use Apple Pay over there, and also you can bring, if you need to bring some cash, you can. But yeah, just bring a little bit cash. That's 1,000, 2,000, something like that, the max. Yeah.
Okay, sure. And about the SIM card, so can we do we have to get a SIM card, or we can just use our US SIM card
It
as long
doesn't
as we
matter.
have
No,
internet?
no. For the same card, it's not necessary for everyone, but be honest. Okay, the American phone is working over there. If you have plan with T-Mobile, the T-Mobile give you a plan as a Global Plus, I think $50 monthly, and you can receive the international and data without any problem with the $50 monthly, and you can use it over there. And also at the hotels, you can use the Wi-Fi. Outside of the hotel, you can use also the American phones. You can, but very important, points when you're trying to use the WhatsApp calling over there. If you're using the hotel's Wi-Fi, you're not gonna receive the calling, but you have to take the Wi-Fi out the hotels and using the American internets to receive the calls. Okay,
I can text. I can send or receive text in either way.
you can.
Okay. Okay, sure. And the last question is, so will there be provision for laundry in our hotel?
I'm sorry?
Will there be can we do laundry in our hotel in Mecca?
Laundry, yes, you can. You can do that, but it's very expensive over there. It's very
Really?
expensive, but yes, you can. You can do. Of course, you can. Yes.
Okay. And if you do have to do that, how do you pay for it? Like,
You can pay when you check out the hotels, and you
Oh,
can pay. Yes, you can give them the room numbers and also the charge. Or you can, once you already send your room to the laundry, you can stop by to the receptions and give them the money for that.
okay, sure. Thank you. That was all. Assalamu alaikum. Thank you.
Anytime for you. Brother Ahmed. Brother Ahmed.
Yeah, I just have one question for the welcome packages that you're going to distribute. You said that there will be hand clothing there. Is it? It's a stupid question, but I have to ask it because some people may have sensitive skin. Is it cotton or is it artificial clothing?
Hamad, do you want to answer this question?
It's a good question. It's a fair question. We're not sure because the ihrams, we don't get to the same place every time. I want to think it's a cotton blend, but we can always double check for you. And I believe your package, your Al Burj 12, so you are going to have the ihram before you arrive. You know what? Message Brother Khalid, and Brother Khalid reach out to Sister Nariman, who's ordering the ihram, and we can find out exactly what it is for you. Okay, Brother Ahmed?
Thank you. I will be there.
Or you can buy one from here and you use.
I have been looking, believe me. I went to Dearborn here in Michigan. I couldn't find cotton on. That's fine. That's okay. Thank you.
If you need it, you can buy anything from here and just use it when you're traveling, just for a travel. And once you arrive at Jeddah, you can buy one from there.
Yeah, that's actually what I'm planning to do. Yes.
Yeah, you can do that. Yes, you can.
And also, Brother Ahmed, if you don't mind, Brother Amro, at Amazon, there's a lot of options on Amazon, and you can read the reviews and check about the quality of the harms and everything.
Amazon is boycott.
There's a lot of options on Amazon. What's that?
Amazon is boycott. That's for my bad luck. So, but,
okay, khair, inshallah.
Thank you, Khalid. Thank you so much, brother. I want to take the rest, Khalid.
No, sir, iPhone.
Assalamu alaikum. So I have meningitis vaccine on June 14, 2022. Do you think I should take another one or just I'm good?
No, you're good. Just take
Yeah, you're good.
I want to answer this question. Go ahead.
Yeah, no, assalamu alaikum, brother. Yeah, it's good. It's fine.
And I have a CTC card, but it is a handwritten. There is a stamp on it. Is that okay, or I should try to get the printout?
No, it should be good.
Okay. Thank you, brother.
Jazakallah khair, Dr. Omar.
No problem.
Salma, Sister Salma.
Assalamu alaikum.
Alaikum salam.
It's my first time to spend like a long time in an airport, and this would be in Washington, D.C. And I would like to know if there is any kind of lounges or what is kind of would be a more comfortable area than kind of sticking with my bag in somewhere in the airport.
Which package you are traveling with, sister?
322 Isra Al Khair.
Isra Al Khair.
It's for my domestic flight. It's coming. I would be in Washington, D.C. A day before, and the hotel checkout would be around maybe 11. I'm not sure, but my flight to Saudi Arabia would be around 7. So it's like about, I'm not sure, about 8 hours or so. So just kind of trying to see I am not familiar if there is lounges or what is available in that airport.
Okay, Brother Amro Al-Bazi can answer this question, sister. 1 second. Go ahead, Brother Amro.
Thanks so much, Khaled. Thanks so much. Sister, yes, the Washington Dallas airport, it's a huge airport. It's a very big airport. Yes, it has a lot of lounge there, and also it's a lot of area. But what I'm sorry, you already booked your hotels already? 1 day
Not,
before?
not yet, not yet.
Okay. I suggest if you need to book your hotel, try to book the hotels next to the airport. Double check in Ashburn area, or One Loudoun or Sterling. Sterling, this is the 3 places 10 minutes away from the airport.
Yeah, I saw that online. Yeah.
Okay, 10 minutes away from the airport. That's why if you check out 12, just stay 1 more 2 hours in the lobby, or you can do at shopping. It's a lot of shopping plaza here, and then you can take a shuttles from the hotels to the airport 3 hours before the flight or 4 hours before the flights. You don't have to spend a lot of money at the lounge at the Washington airport.
Okay, got it. Okay, thank you.
Anytime for you. Thank you, Khaled. Thank you so much.
Last question for JHA.
Yeah, Assalamu alaikum. My question to Dr. Omar, what's the best time or like the phase of sickness to start taking the antibiotic?
Dr. Omar.
Yeah. Yes, assalamu alaikum. So it's best to take it at onset, whenever you start feeling that you're coming down with the symptoms. So that's, you will know because you start developing fever, you start getting, like the cough, or, start getting either a dry cough, productive cough that's associated with a fever. Fever normally is an indication of something is going wrong with your body. That's how the body would fight. You get an inflammatory response and you start developing a fever. So only you would know what kind of symptoms you're having at that moment. So you'll know if it's in your chest, you'll know if it's in your head, meaning you have a sinus infection, meaning you have an upper respiratory. So that preferably you take it at onset and start. For instance, like I said, the antibiotic for pneumonia, for upper respiratory infection, a Z-Pack is taken normally 2 tablets at onset, which is that day, then 1 day for 4 days afterwards. If you have a
What's the
flu-like
milligram? Yeah,
What's
what's
that?
the milligram? Is this 500 milligram
No,
or
no, it's
1000
200.
milligram for?
Z-Pack is 250 milligram. It does come
But
something
if it,
it
yeah,
comes in something
for
called,
me,
it's a
yeah, I'm
tri-pack.
allergic, so I
Go ahead.
can take this kind of medication, maybe just specific one,
Which
and
one is
it's
Z-Pack?
cephaloxacin,
Yeah.
Keflex,
Yes, that's
and it's
cephaloxacin.
500. Yeah.
Yeah, that is actually, it's called a cephalosporin. That belongs to a totally different class of medication than zithromycin. The zithromycin is a class that's called macrolide, and it like Biaxin, azithromycin, they're totally different than cephalosporin. So you are okay to take azithromycin. So the people.
Actually, I'm also allergic to this one, just cephaloxacin I can take. So in this
Oh,
case,
you only can take. Okay, so you're allergic to azithromycin. That's what you're telling me.
yeah.
Okay, if you're allergic to the azithromycin for upper respiratory infection, pneumonia, we prescribe doxycycline, 100 milligram twice a day for 7 days or 7 to 10 days. So doxycycline, that's what you take. And that is a totally different classification. That's called a tetracycline. So I'm pretty sure you're not allergic to that. So that's a different class. So that's your alternative drug of choice.
Yeah, Jazakallah khair.
Thank you. Thank you, Brother Khaled. Thank you, everyone, for attending. Hopefully this was helpful, inshallah. Big thank you to Dr. Omar for all of your help. And I'll re-emphasize, he was in Hajj, inshallah. We posted the slides and also some of the medicines on our WhatsApp group. All posts will be there. If you're not seeing that, reach out to your rep, inshallah. Very important, you're on there now. Telegram is great to communicate, especially I recommend everyone now change your Telegram name to include your group number so you can kind of know who's in your group, who you're traveling with, because a lot of the WhatsApp groups are closed to chat at the moment. But Telegram, like Adam Family, will be more casual. The meat and potatoes of everything will be on the WhatsApp group going forward because it's where everyone is and all the guides are. Beyond that, everyone enjoy their day, inshallah. We will see you next week for another seminar. And I know a lot of you have seminars tomorrow as well. So looking forward to those, inshallah. The heavy seminar, a few weeks, inshallah, till we travel. Again, the chats are available, Telegram's available, and your account reps are available. So we look forward to providing any answers you need at any time, inshallah. Again, big thank you to everyone, and assalamu alaikum.
Assalamu alaikum.